I mean, my role as a cardiologist, first and foremost, is to really provide good preventative care for my patients. I try to teach them the overall healthy lifestyle. And in this area, the majority of the people are really healthy. And the older population, they know what they want and they know what they don't want. They've seen it all and they've lived through it all. And it's a fun population to be dealing with. Staying active, I mean, that's probably one of the most important things, because if you live a sedentary lifestyle, you're not going to really know if your heart is declining. And one thing we don't prescribe enough is activity. So that's one thing I try to push for my patients. And if they notice they decline in their activity, then there's something that should perk up and that I should investigate. Again, I'm a cardiologist, so I try to prevent heart attacks and any further cardiovascular disease. But the same token, we have to do what the patient wants. Part of medicine is not just ordering labs and not just looking at, echoes or imaging. Part of the art of medicine is the history. And getting a good history from a patient is the doctor's job, but also letting them know that they can be honest with you and that anything they tell you is not stupid or they shouldn't feel shy about. Some patients I have, they'll say, I had this chest pain, it was nothing. When you investigate it further, you realize it was substantial. That's why I would ask one question in like 10 different ways to make sure that what they're telling me is really not a concern. I think majority of patients know that I listen to them, that if they need anything, I'm here. And also, if I don't know something, I look it up. One thing that attracts patients to me is the Deborah name. And they tell me, we didn't know that there was Deborah Manahawkin. They love Deborah. I mean, they have good experiences there. Patient always has a say. Wherever they want to go, they go. But as far as non-invasive testing, echocardiogram, nuclear testing, ultrasounds of the legs, we try to do most of them locally because the drive is about 35, 40 minutes out there. And some of them don't want to take the drive, and that's fine. I have some patients that only want to get all their tests done at Deborah, and that's fine too. But as far as the patients being happy that we're here, they love it. And when they find out that we're here, they want to come here because it's closer to them, obviously. I have some patients that they come and see me one time a year, and they see somebody at Deborah one time a year because they don't want to leave that doctor there. They feel bad. And that's what's great about Deborah, because we actually communicate. Even though I'm 45 minutes away, I still get great communication about my patients and their care. One thing about me is I'm a doctor of osteopathy. In medical school they teach us to look at the patient as a whole. But they also teach us not only about the ailments of the patient, but also do they have stress in their lives? Is there other things that could be affecting the patient's health that's not related to a disease process? Because patients today are looking for alternative stuff. And to have an open mind about it, at least an open mind, I think is beneficial. I always ask my patients, do you have a lot of stress in your life? Is there things going on at home that could be affecting you? Because chest pain, palpitations could be a problem just from that. We see in the news that depression is related to heart disease. And that's something as cardiologists we shouldn't ignore. First of all, I'm from Long Island. So I never would have lived in Jersey, I thought. But I married a Jersey girl, so I moved to Jersey. We have a new baby at home. So I miss my wife and my son all the time. I love electronics. I'm a tech guy, so I'm always into the newest thing coming out. Growing up, I always said I wanted to be a doctor. But when I was a child, I went to acting school and I was looking to do movies. I was in a HBO movie with Stephen Wright, but I was an extra. It wasn't a big deal. And at one point, I did make a decision to either pursue acting or pursue a medical career. And when I did that, that's when I went towards, applying for medical school and stuff like that. So, I don't know what my life would be today with going that other direction, but I'm very happy with my choice. It was fun, yeah. But I don't think it's really truly what I wanted to do, though. Deep down inside, I think this is the direction I was supposed to take.